Welcome to NetLawMD's e-learning platform on billing and CPT codes for advanced care counseling. Advanced care counseling services may be billed by physicians, non-physician practitioners or NPPs, which include nurse practitioners, physician assistants, and licensed clinical social workers that are master's level prepared. They must have an MPI number and a Medicare billing number. CPT code 99497 is for the first 16 to 30 minutes face-to-face with the patient, family, and/or surrogate. CPT code 99498 is each additional 30 minutes face-to-face with the patient, family, and/or surrogate, billed in conjunction to initial code. So for example, if you get to 46 minutes face-to-face with the patient, you're able to add CPT code 99497 and 99498 to your visit with the patient. ACP code overview. It's a good source of reimbursement for healthcare providers. Codes are primarily time-based and can be reported in all settings, with or without accompanying E&M services. Documentation should reflect the length and intensity of service. What services are covered? Medicare provides no specific requirements for using ACP codes beyond what is included in the CPT code descriptions. Advanced care planning may include discussion of goals and preferences for care, complex medical decision-making regarding life-threatening illness, explanation of relevant advanced directives, including but not requiring completion of healthcare documents, engaging patients, family members, and/or surrogate decision makers as a clinical situation requires. Documentation best practices. Document a brief summary of the voluntary conversation. Details should reflect and justify length and complexity of the conversation. Document who was present, including the patient. Document length of time spent face-to-face with the patient in minutes, either start-stop time or total time. So for example, you spent approximately 18 minutes with the patient, or the advanced care counseling session started at 11:20 a.m. and ended at 11:40 a.m. Healthcare document form completion may or may not occur. If forms are completed, document which forms were completed. No diagnosis requirements. Diagnosis can be advanced care planning used stand alone. If a serious illness is featured in documentation, it should be reported on the claim. Sample documentation for healthcare providers. The first option is a brief summary of an advanced care counseling session, but includes everything required for Medicare reimbursement. It states it was a voluntary discussion, what was discussed, who was present, the patient's diagnosis, if forms were completed or not, and how much time was spent with the patient. You may also include the patient's prognosis if they have a life-limiting or terminal condition. The more detailed option 2 includes everything from option 1, but also states the patient's code status, if the patient is competent or unable to make their own decisions, and if a healthcare surrogate was present with the patient or not. Who can report ACP codes? Qualified providers defined under Medicare Part B can report ACP CPT codes for payment, which include physicians, nurse practitioners, physician's assistants, and licensed clinical social workers who are master's level prepared. Providers who may not report codes independently are psychologists and chaplains. Where can the ACP codes be reported? ACP CPT codes may be billed by qualified providers in any clinical setting, which includes inpatient, observation or emergency department, outpatient clinic, home or domicile, skilled nursing facility, long-term care, or hospice if the qualified provider bills Medicare Part B. ACP codes can be billed on the same day as a new or established patient visit, an annual wellness visit once yearly, hospital observation or inpatient visits, consults, emergency department visits, nursing or domiciliary visits, home visits, and transitional care management. ACP codes cannot be billed with most critical care codes, care plan oversight codes, or new cognitive impairment evaluation codes. How frequently can codes be reported? No limit to frequency. It's guided by medical necessity. An annual wellness visit is limited to once per year, and there is no copay. Documentation should report all services, especially high frequency or prolonged time. ACP CPT code summary. Time-based code can be provided at any site of service. Documentation should support services delivered. Does not require another E&M service to be reported. Can be reported after 16 minutes of services with or without an accompanying E&M code. RVU values are the same in any site of service. So for CPT code 99497, it's equivalent to 1.5 RVUs. And for CPT code 99498, it's equivalent to 1.4 RVUs. This completes the e-learning video. Thank you.